Welcome, students, to our last unit of the year, Unit 14. I don't know what's happening with my picture, but in Unit 14, we'll be focusing on abnormal psychology and therapies. Now, just a quick review. I'm not going to go into great detail here. I'm going to give you guys just the facts, just the basics of what you need to know, because as you know, your presentations should include all the elaboration and detail, the real-world examples, the causes, the treatments. That is what I'm expecting from your presentation. So again, I'm just going to cover just the facts. All the elaboration comes from your classroom presentations. So let's begin. In Unit 14A.1, we'll be focusing on perspectives of psychological disorders. This one will not be presented in class, but you're still going to be expected to know it for the exam, and more importantly, the AP exam. So before we get into the perspectives, we need to first define abnormal. What is abnormal? How do we define psychological disorders? A psychological disorder is a harmful dysfunction in which behavior is judged to be atypical, disturbing, maladaptive, and unjustifiable. Now, it's important to know that atypical behavior is not enough in itself to classify as disordered. It needs to include all of these components. Behavior that is disturbing, or what we classify as disturbing behavior, may vary with time and cultures. For instance, calling someone a name back in the 50s that you called them might have been acceptable, but if you call them the same name now, it could be taboo or could be offensive. So just like that, behaviors can change over time. And then behavior is also disorders. It's maladaptive. If it's harmful to you or others, and if it's unjustifiable, if it makes no sense, if there's no reason to it. So an example of this, or an example of disordered behavior, or a behavior disorder, would be attention deficit hyperactivity disorder, also known as ADD or ADHD. Back in the 50s and 60s, ADHD was very, very rarely diagnosed. However, as children, I guess, are becoming more hyperactive, at least that's the perception anyway, they're becoming so hyperactive that they can't control themselves or maintain focus, then they will be diagnosed with ADD and prescribed medications. However, how do we know if a child's hyperactivity is abnormal or if it's just normal child behavior? I mean, children have bundles of energy. Well, if it fits these four criteria of atypical, disturbing, maladaptive, and unjustifiable, then that would then classify ADHD as a disorder. However, ADD is much more, it has a higher diagnosis on the West Coast than it does on the East Coast of the United States, and then most other countries around the world don't even have a classification for ADHD as a disorder. So depending on where you are and what time period you're in, ADHD is not considered a disorder. So real briefly, what are the causes of psychological disorders? Well, let's go back in history first. Let's look at this through a historical lens. Some of the perceived causes going back 1,000 years, you can go back 100 years to look at some of these perceived causes and treatments. Because again, psychology is a relatively new field of study. So from a historical perspective, before we knew about the workings of the brain, about the biochemical structures and functions of the brain, some of the perceived causes back in the day for psychological disorders were possibly movements of the sun and of the moon. If the moon would come out full during the day, it could be a cause for a disorder. Of course, or another cause could be evil spirits. Maybe you're possessed by a demon, which would require the treatment of exorcism. Or maybe you might be caged like an animal and poked with a hot rod or something. Or torture. Torture was a usual treatment. For example, they might bleed animals and force you to drink the blood, maybe cleansing your own blood. They would beat you. They might burn you. They possibly might castrate or mutilate you in other ways. Bleeding. They might extract blood from you. This is how George Washington died. It was believed back in the day that if you were sick or if you were disordered or diseased, then the best way to cleanse you your symptoms was to cleanse you of your blood, because blood was thought to carry viruses and all the negative things. Okay, well, we've learned, and we know better now. All right, so let's talk about the actual causes of psychological disorders. Now we're going to be looking at these causes through the lenses of different perspectives, and we're going to first start with the psychoanalytic perspective. All right, the psychoanalytic perspective of the causes of abnormal behaviors results from internal conflict in the unconscious stemming from early childhood experiences. So, for example, it's your psychological disorders through the psychoanalytic perspective is caused by your failure to resolve childhood issues, like the Oedipus complex, for example. According to the behaviorist approach, which again emphasizes learning, abnormal behaviors consist of maladaptive responses learned through reinforcement of the wrong kinds of behavior. So if a child goes and punches some other kid on the playground and his parent gives him a cookie later, he's probably going to continue to demonstrate adverse behavior. Or if you give the child what they want all the time, the child's not going to be disciplined, and that's going to develop adverse behavior as an adult. According to the humanistic perspective, abnormal behavior results from conditions of worth society places on the individual, or the lack of, or being blocked from achieving your self-actualization. So, for example, if a person keeps failing, like learned helplessness, and they get fired from their job, they will show maladaptive behavior. It might be severe depression or others. The other perspective is the cognitive perspective. According to the cognitive perspective, psychological disorders comes from irrational and illogical perceptions and belief systems on reality. So, for example, we do not handle situations in the appropriate manner because of some kind of mental distortion of truth, or right or wrong. So belief bias, for example. If someone comes and says, hey man, I don't think your presentation was very effective, and then you take out a knife and start threatening with it, that would not be an appropriate response. Okay, so not being able to take, overblowing that situation would be a cognitive explanation for psychological disorders. The evolutionary approach, the natural selection approach to disorders, states that your brain does not perform psychological mechanisms effectively. So, for example, your parents handle situations in a maladaptive way, so you might do the same because of the genetic predispositions that were passed on to you. This goes hand in hand with the biological approach. The biological approach assumes that abnormal behavior is the result of neurochemical and or hormonal imbalances. So, for example, you might have heightened levels of dopamine, which can lead to schizophrenia or Parkinson's. And then the medical model. The medical model, okay, so we're over perspectives. Now we're looking at approaches to understanding. And the first is the medical model. All right, the medical model is the concept that that diseases have physical causes. They can be diagnosed, treated, and in most cases cured. Symptoms can be cured through therapy, which may include medical treatment in a psychiatric hospital. Some terms that follow the medical model are psychopathology. This is the study of the origin, development, and manifestations of mental or behavioral disorders. All right. There's etiology, the apparent cause and development of illness, and then prognosis is the forecasts, the probable causes of the illness. So these are phrases and terms you might hear if you see a psychiatrist or are interned in a mental health facility. So that's the medical model. As you can tell, its primary focus is on biological, is on the biological perspective. However, in my opinion, I think the more appropriate approach to understanding psychological disorders is the biopsychosocial perspective. The biopsychosocial perspective assumes that biological, socio-cultural, and psychological factors combine and interact to produce psychological disorders. And so because of that, you would use more of an eclectic approach to treatment. You might use some neuroscience approaches. You might use some cognitive approaches. You might use some behavioral approaches. Whatever approach you can use to alleviate the symptoms of your patient or client, that's what you're going to do. So, for example, here is a diagram of the biopsychosocial approach. So social components that may contribute to your disorder might be rules imposed on you by society or by school even, expectations, and the definition of normality and disorder that's imposed by society. That on top of biological causes, like evolutionary causes, like we just discussed, individual genes, brain structure, and chemistry, and then also psychological causes, stress, trauma, learned helplessness, and how they interact together to create a disorder or develop a disorder. And then the last thing we'll discuss in this unit, but certainly not the least, is the DSM. The DSM, also known as the Diagnostic and Statistical Manual of Mental Disorders, is the rubric that psychiatrists and psychologists alike use to diagnose an individual with a disorder. All right? So you might notice that it says DSM-4 here on the book, but it has been recently updated as of 2 years ago to the DSM-5. And again, this is a publication by the American Psychiatric Association, and is a widely used system for classifying psychological disorders. The DSM is comprised of 5 axes. So let's talk about these axes and how they contribute to the overall diagnosis of the individual patient. Axis 1 is clinical syndromes. What syndromes or symptoms are present in the individual? Are they demonstrating symptoms of bipolar disorder? Are they demonstrating symptoms of schizophrenia? And then based on the information from Axis 1, we can then identify Axis 2. This is the disorders. What type of disorder does this person have based on the information from Axis 1? Is it a particular mood disorder, like depression or bipolar? Or is it a personality disorder, like anti-personality disorder? Or is it an anxiety disorder, like panic attacks? So based on Axis 1 and Axis 2, we then take into consideration Axis 3. These are physical conditions, are medical problems, things that might be medically wrong with the patient. Maybe a chemical imbalance. Maybe they have, they've had a heart attack recently, okay? The reason we take this into consideration is if there's anything medically wrong with the patient, then that might be the explanation. Yes, that might be the explanation for why something's wrong with them. It might not be psychological. It might just be medical, in which case that would alter our diagnosis. And then Axis 4 is the severity of psychosocial stressors. These are environmental factors, is Axis 4. Like maybe you just experienced the loss of a loved one. Maybe your house burned to the ground. Maybe you just got a divorce. All right, that can lead to depression and stress, which would contribute to the overall diagnosis. And then Axis 5, what is the level of functioning of the patient? If the patient's symptoms and medical and environmental factors are really hindering their behavior, it's really leading to maladaptive behavior, then that's going to affect the severity of the disorder. All right? So those are all the axes of the DSM-5. And based on your overall score, it will indicate the severity of your disorder. All right? If you score 90 to 100, you're in the clear. If you score 0 to 10, you are severely disordered. Again, that is a quantitative value. Now, the thing is with this is some critics would say that this opens the door to the labeling effect, that if you label someone a certain disorder, then the self-fulfilling prophecy might kick in. They might start to demonstrate symptoms of that disorder. That's one criticism of this. So how do we start to really classify specific disorders in a scientific way? Now, although he was not scientific, we do give him credit for starting this process. And it was Freud. Freud first identified disorders as neurotic disorder or psychotic disorder. Neurotic disorders were usually distressing, but allowed one to think rationally and function socially, whereas psychotic disorders were where a person loses contact with reality and experiences irrational ideas and distorted perceptions. That's it. Talk to you guys later.